country? Please vote. Well, comprehensive health care reform began in this country in the 1912 to 1914 period. The election that pitted Taft against Roosevelt against Wilson. And Roosevelt was campaigning hard for a universal health care coverage policy. It was sort of modeled on Bismarck's social reforms in Germany in the late 1880s. And what do you think happened? Who opposed reform? The public voters. Why do the public voters turn against this? What happens in 1914? Germany did go to war, however, against England and France, right? And all things German became suspicious. Universal health care coverage was German. That was one reason. There is a second, very important reason, very ironic reason. Organized labor. Anyone hear of Samuel Gompers? Remember that from U.S. history way back when we took the AP? Samuel Gompers, first big labor organizer in the United States. He opposed it. Surprising, universal health care coverage, and the labor unions opposed it. Why? They thought they could get a better deal by negotiating with business and industry. Boy, were they wrong. Next attempt, 1933 to 1936. Franklin Roosevelt attempts or thinks about putting in comprehensive health care reform in the Social Security Bill of 1936. It doesn't happen. Why doesn't it happen? Doctors begin to oppose it, and he doesn't even put it in the bill for fear that it will sink Social Security. So it doesn't even get the legislation. 1948, Harry Truman, last president without a college education, haberdasher from Missouri, committed to universal health care coverage. Really, really strongly believes in it. Probably believes in it more strongly than any president before that and since that. Campaigns, stakes his entire presidency really in some ways on it. He's come to be known for many other things afterwards, but during his presidency, this was a major issue, killed by opposition, organized opposition by the AMA. Question, get those clickers out. 1960 election pitting Richard Nixon versus John Kennedy. Which one of them was for comprehensive health care reform? Well, the true answer is that both campaigned for comprehensive health care reform. John Kennedy got elected, and it was very difficult, if not impossible, for him to get anything through. Even introduced in Congress. Then he gets assassinated in November of '63. Lyndon Johnson takes up the mantle and says, we have to finish Kennedy's agenda. We have to enact comprehensive health care reform. Goes nowhere. Dead silence out of Congress. This from probably the president who knew most about a twist arms in Congress. Nothing happens. He then wins a landslide election victory against Barry Goldwater in 1964. And Congress decides suddenly to have hearings about health care reform. Johnson turns to his team in the White House, get him a reform proposal. Does he propose comprehensive health care reform? No. What's he end up with? Medicare and Medicaid. Medicare covering who? The elderly, 65 and over. So the people who are no longer employed can get insurance to cover those people who can't get insurance through their employer. Medicaid covering. What does Medicaid cover? Poor people, people who are unemployed, don't have a job, and the assumption is everyone else in between has employer-sponsored coverage. But it's not universal health care coverage. Medicare gets over 65, so it is universal Medicaid. It's the state-based program. Richard Nixon from? Where?
California?
California. What do you know about healthcare in California, anyone? You got organized healthcare systems like Kaiser there. Richard Nixon was used to organize managed care organization, and he was very, despite being a Republican, very pro comprehensive healthcare reform. He agreed with John Kennedy in 1960 that we needed comprehensive healthcare reform. Then in the Senate, you had Teddy Kennedy. Teddy Kennedy, long-standing champion of healthcare reform ever since he got into the Senate. And then in the House, you had Wilbur Mills. Many of you have not heard the name Wilbur Mills, but in the 1960s and 70s, everybody knew who Wilbur Mills was. He was a congressman from Arkansas, chairman of the House Ways and Means Committee, and all comprehensive healthcare reform has to go through Ways and Means. And because any healthcare reform bill is going to be about taxes and spending, it goes through that committee. That committee has claimed jurisdiction over healthcare in the House. Amazingly enough, almost never happens in American political history. You've got these three people agreeing on the need for comprehensive healthcare reform. And then what happens? Danny Bouts. Congressman Wilbur Mills was driving one day in Washington, D.C., late at night, around 2 a.m., and an exotic dancer fell out of his car into the tidal basin. He got cut on his face. His car didn't have headlights. He was a little inebriated. It was a fantastic Washington scandal, and it left in its wake healthcare reform. Because this was the guy who was going to shepherd it through the House, but he was embroiled in a scandal with that very attractive-looking Fanny Bouts. Next time that name comes up in Trivial Pursuits, you will know exactly who she is. Not a health insurance industry louse. Then we move fast forward from 1972 to 1993. Bill Clinton's big issue is going to be health care reform coming into office. It's so big, he does what? He appoints his wife as head of the task force that's going to come up with the health care reform bill. Now, why did Bill Clinton make health care reform the key initiative early in his administration? I will tell you, I met Bill Clinton in November 1991. Right? A year before the election and a year or 15, 16 months before he became president. There were four of us in the room. And I was introduced to him, and he said, well, if you have any healthcare ideas, bring them to me. He had no healthcare plan. No interest in a healthcare plan. Why, a year later, is this the key to his administration? Anyone know the name Harris Wofford? We are here in the great state of Pennsylvania. Harris Wofford. Yes, tell us the Harris Wofford story. He ran in an election and at a campaign stop spontaneously talked about the need to guarantee everyone health care. And his poll numbers went from like non-existent way up. Every politician took notice. This health care thing seemed to make a difference. And he kept campaigning on getting universal health care coverage in. Now, it sat well with Harris Wofford. Why? Because Harris Wofford was appointed in the Kennedy administration, head of the Peace Corps. He was a diehard liberal, and this fit with his agenda. But lots of other politicians, including Bill Clinton, who hadn't noticed health care, who hadn't had a health care plan, suddenly had a health care plan. And it was a big part of the campaign. But it went down to defeat. There was a real particular. I'm going to give you an overview of the bill, and then we're going to talk about the access. But before that, we're going to ask this question. The majority of the provisions of the ACA, that's the Affordable Care Act, that's what its acronym is, are focused around increasing access to health care. True or false? True, 54%. False, 46%. So happy you think it's all about access, and happy you think it's not all about access. Well, it's good to know it's not all about access. So there are lots of provisions, and I'm only going to give you the sort of highlights here, and then we're going to go in depth on this, and then in subsequent weeks on the others. Right out of the box, there are a whole series of insurance market reforms, which we'll talk about in a second. There's expansion of Medicaid and CHIP for people under 133% of poverty. There's the individual mandate that says that you have to buy insurance. There are subsidies to help people buy insurance. And then there's the establishment of these insurance exchanges as an easy place to go out and buy insurance. On the cost side, there are a whole series of delivery system reforms, which we'll talk about. We reduce payment to Medicare Advantage, that's Medicare Part C, those are the managed care plans from Medicare. Substantial reduction in payments because calculations have shown that they were being overpaid by at least 14%, and at least some professors at Penn, Mark Duggan among them, thinks it's way more than 14%. We reduce payment for other Medicare providers, home health care agencies, for example, which have been paid excessively. The tax exclusion, so as we talked about, people getting a tax break for buying insurance, or getting insurance through the employer, that is being capped in 2018. ACOs, accountable care organizations, we'll talk about that. Bundled payments, a way of changing how you pay for services. IPAD, the Independent Payment Advisory Board that puts in cuts if Congress can't enact cuts if Medicare inflation is too high. PCORI, Patient-Centered Outcome Research Institute, another part of the bill that looks at comparative effectiveness, which we'll talk about next week in depth. And the creation of a $10 billion innovation center. On quality, there is essential benefits. That's actually gives you a minimum. That's why we're arguing about things like contraceptive issues. Access to preventive services without a copay, so that there's not a financial barrier to getting preventive services like mammograms, like pap smears, colonoscopies, and preventive services like contraception. Patient safety, there's a big patient safety initiative in the bill to reduce hospital-acquired infections and other associated problems such as falls in the hospital medication areas. And then finally, a big effort to reduce readmissions so that we go from that 20% of readmissions of Medicare patients discharged down. And then there's what some of us call lots of cats and dogs or other issues. There's a whole section on workforce where there are various provisions to increase the number of nurses, increase the number of primary care doctors. There are various public health initiatives and public health programs. There's some wellness programs, and there's the famous calorie posting in chain restaurants and vending machines, requiring that any group that runs more than 20 chain restaurants like McDonald's or Burger King are now going to have to post caloric content on their menus. I want you to think politically again here. You passed a bill in March 23rd, and signed into law by the President in 2010. And there's a bunch of provisions here you can see that happened in 2010. Why do you put them in? Why are they there? So you give people things that they feel right away so that they can see that bills actually made their lives better. Okay? Very common political tactic. Right? You don't want the payoff of everything 10 years down the line, even if 10 years down the line is when it really will pay off. You need something early on to generate support. So, there's a whole series of things in the bill. We have a review of insurance premium increases to make sure they don't go too high, to put pressure on the insurance industry to keep premiums down so that people see the bill's actually controlling costs for them. PCORI, that's a Patient-Centered Outcome Research Institute. That is controversial. That's established, but it's a way, Sandy will talk about this, of buying off various people in the industry, etc., by putting them on the board. Medicare Part D, the elderly, the single largest group opposed to this bill, right? Separate from Republicans, but in an age demographic. They were opposed in general to the bill. Why? Well, they already had insurance. This was just going to give it to other people. So you had to buy them off with the goodie. We were going to buy them off with, but we did try to buy them off with closing the donut hole. Increase Medicaid drug rebates to get money so that the cost of drugs and Medicaid would go down. Small business tax credits. If you're a small business under 25 employees, you can get a tax credit to provide insurance. Ain't a great tax credit, but it's still there. Pre-existing insurance plan. That's for people who can't get coverage, who have illness. You create a special pool of money so they can get insurance. This second to last one, adult dependent coverage to age 26. You know, what's going to happen when you guys, the people who are undergraduates here, graduate, your insurance from Penn runs out, you don't have a job, God forbid. Or you have a job, but it doesn't provide insurance. One of the very interesting phenomena here is how bad a job there's been around communication of what's in the bill. So these are just some data from the Kaiser Family Foundation polling. Maybe not the most reliable polling, the response rate ain't so hotsy-totsy. But you can see that the highlighted one at the top, only 47% of the people view guaranteed issues favorably. What's guaranteed issue mean? You apply, you get it, they can't exclude you for a pre-existing condition. You're guaranteed to have the insurance issued to you. It's a way of preventing insurance companies from discriminating against people